My name is Kim Boothby, and I am going to be doing a primary IV is running, and I'm hanging a piggyback medicine. I've checked the doctor's orders on the MAR, and he's ordered for mini pack flagyl for it's ordered in 500 milligrams per 100 milliliters, and it's available in 250 milligrams per milliliter. So that means I'm going to pull up 2 milliliters. I've assessed the labs, and he has ordered and I've assessed for his allergies. The patient has no allergies, and he has the flagyl for his bacterial infection. It's an anti-infective, anti-protozoal, and anti-ulcer agent. The action is it disrupts the DNA and protein synthesis of susceptible organisms. The purpose is for the patient's bacterial infection and dizziness, seizures, meningitis, encephalopathy, optical neuropathy, and rash, and of course allergic reaction to the antibiotic. But the patient has stated that he has no allergies, so it's already got it's got normal saline running for his dehydration. So now I'm going to take and I'm going to clean off my flagyl, and I'm going to pull up 2 milliliters to insert into my mini bag.
Now I am going to,
this is 100 milliliter bag.
Again, check my insertion site that there's no swelling, redness. I'm going to ask Mr. Miles if he's doing okay. I'm going to ask him if he has any headache or nausea, and I'm going to come back in 10 to 15 minutes to double check on him, and I am going to document.
This is completely sterile.
The time, the date, the route,
I am going to wipe off
the IV site.
just to make sure, and I'm going to inject the 2 milliliters into my 100 milliliter bag.
The drug, the flagyl.
I'm going to dispose of this into the sharps container, and I'm going to mix in my bag.
Come back and
I'm going to label my medicine with the drug name, the dose, the client's name, the time of administration, and my initials.
I'm going to come back
in order to hang this, I'm going to have to hang the primary lower, which I have done. So it's going to hang lower, and this will hang higher so that it will infuse into the patient. And then when through, I will disconnect this and reestablish the normal saline. So this is my secondary line. It is right out of the package, sterile.
Attached alligator clamp.
So this has the clip on it, so it's sterile. And I'm going to remove the lid off this.
Hang that there. I am at this point going to double check this.
So I'm going to connect
the IV site is no pain, no swelling, no redness. Everything is good to go. I am going to reestablish the correct
infuse through so I can fill up the
drip for the primary IV. I don't know what you're saying, Ashley. This thing's leaking. I don't know what you mean.
Okay. And I will also label my tubing with the date, the time, and my initials.
First
and
off,
I'm going to put alligator
just say that
on it afterwards, so the next person can come and use the same tubing to give their antibiotics.
You can't do this lot. You're gonna have to remove this.
The old one isn't connected anymore. Why does it matter?
This is still sterile.
Because it's still your
And I'm
primary.
going to come in, I'm going to introduce myself to the patient.
I know, but it's only
I'm going to look at the IV. It's, of course, it's running. And I'm going to ask them the name, the date, and I'm going to check it along with their name, date of birth, and I'm going to check it against their armband. I'm also going to instruct them that the doctor has ordered antibiotic, and he's getting it every 8 hours.
Before you left his room,
So
I didn't take my gloves off.
first time, you
I'm
didn't
going
take
to
your gloves off, you
clamp
didn't
off.
wash hands.
She said she wasn't going to go into details.
I'm going to wash my hands and apply my gloves, and I'm going to use the first part, and the clamp is below it so that it will stop the normal saline, and it will start my antibiotic flowing. So I'm going to clamp this.
And you didn't have to
I'm gonna not
reestablish
clamp
the
it
flow
till-
rate, this
I'm
is
gonna clean
why.
this. I'm gonna go ahead
Our
and
clamps are below the port for a piggyback.
go ahead and
Doesn't it
insert
say on there
this.
that you have to?
You clamp it off if the clamp is, if
And I'm
this,
not gonna touch it because
it
it's
pisses
stale.
me off, they didn't even go over this with y'all. If this guy was above here,
And I'm
you
gonna
would
adjust
clamp
the
him
height
for
by
a
looking
permit.
at my watch
and you would put your
And it
piggyback in,
drops.
you would run it that way.
and ensuring that it's
Because
running
this is
at
below
17
this, and it
drops
says it on there,
per minute.
you don't clamp it. If you clamp it, you clamp everything. So,
If
I'm gonna check that the IV's running good and that it's not infiltrating and the patient has no pain.
so I never had to
And I'm gonna
adjust.
tell them I'll be back in
a
15
normal
minutes to
saline
check
rate.
on
That's
them.
the reason I put it
And
at the rate
I
put
leave,
it at.
come back 15 minutes later, check on them, everything's running good. So I
So
tell them
you
I'll be
don't
back
have
in
to
45 minutes when the
You
IV is done
verify
running
this-
to
this is the
disconnect.
normal saline,
Okay,
the
it's been
doctor
45
recommends
minutes.
primary.
I'm returning into the
He's
room.
got
Of
it
course,
at,
I'm gonna wash my hands.
20
and I'm
drops
going
a
to-
minute.
I'm going to come in and I'm going to, this is empty.
It's 20
So I'm
drops a
going to
minute.
disconnect.
That the tubing itself is within time.
And I'm gonna hang, alligator clip this and hang this back up for later. And I'm gonna
Yeah.
adjust the flow rate
You clamp
for
it.
the normal IV, normal saline that's running. And I'm ensure that it's running at the proper dose. And I'm gonna just check and make sure it's not infiltrating. And I'm gonna ask him if he gets any problems or any pain or redness to give me a call. And that is attaching the piggyback. I'm also up before, I'm gonna document on the MAR that I've given their IV, the route, the dose, the time, and the medication given. And I'm gonna state the condition of the IV site and recorded on their intake and outtake and how he tolerated the IV. And that is it.
I agree with you, but she's not